Medications now are considered as almost a third leading cause of death. There is a safety issue, and there is also an issue of inappropriate use of all medications. So we're trying to come up with a document or guidelines that will help us to ensure that we give the best of pharmaceutical services for this country. As I said, there is a big issue of drug-related morbidity or deaths that occur from this one. So the guidelines will address the safety issue. There's also an issue, you've had cases where drugs are expiring and are costing billions. There will be an issue of supply chain management. There's also the issue of manufacturing of poor quality products. This will be also partly be addressed. But more importantly, in the area of primary care, primary health care is a big focus under the UHC, in other words, the universal health coverage is very important. We also, in the public arena, we have the issue of public health as an issue, and we like the pharmacists and pharmaceutical technologists to be more engaged to provide to the community primary health care as well as public health. Pharmacists were never responsible for what we call the drug therapy outcomes. This was a responsibility of the medical doctor. But now we've actually realized that this medication is not properly handled. If you don't monitor, you get poor outcomes. So they are coming in to complement what is lacking at the moment. There's a huge gap. They will be held responsible for what happens to the patient. They will have a shared responsibility, but theirs is to ensure that the drug therapy the patient are getting is, number one, it's most appropriate. Number two, it's as safe as possible. Number three, it's the safest possible. And number four, that the patient is able and willing to comply to the instruction to get the best outcome. So there's this increased responsibility. So we are now moving away. We used to be more on what you call product-centered, more on preparing the product. But now we are more interactive in the sense that we are now patient-centric. In other words, we are now patient-centered, and we're taking responsibility. And the emphasis now is on the medication use.